Your dog looked at you this morning, and you had no idea, but something was deeply wrong. Most dog owners only find out their pet was suffering after the damage is already done, sometimes too late to reverse it. The signs were there the whole time, hidden in plain sight. And because you love your dog, you need to watch this entire video right now. Welcome to Canine Mind. If you're new here, subscribe right now because we cover what dogs can't say out loud. Today, we're going to go through 16 signs that your dog is silently crying out for help. Some of these are obvious, others are so subtle that even experienced dog owners miss them for months. By the end of this video, you'll know exactly what to look for and what each sign could mean for your dog's health. Let's get into it. Sign number 1, sudden aggression. You know your dog. You know their personality, their quirks, the way they greet you at the door. So when that same dog suddenly starts snapping, growling, or showing teeth over nothing, pay attention. Dogs don't become aggressive for no reason. When a previously calm dog starts acting hostile toward people or other animals they've always been fine with, that shift is almost always connected to something physical. Pain makes dogs reactive. An infection brewing inside the body can alter behavior drastically. Before you assume it's behavioral, rule out the physical. A dog who is hurting will protect themselves the only way they know how, and that's through aggression. Don't punish it, investigate it. Sign number 2, refusing to eat. Dogs are enthusiastic eaters by nature. Most of them would eat their entire daily portion in one sitting if you let them. They'll eat off the floor, off your plate, off the couch cushion. Dogs are not picky.
That's exactly why a dog who suddenly loses interest in food is sending you a clear warning. If your dog skips one meal, watch them closely. If they go more than 24 hours without eating, that's a trip to the vet. Loss of appetite is connected to a staggering range of conditions: bacterial or viral infections, intestinal parasites, gastrointestinal disease, pancreatitis, kidney failure, diabetes, and in serious cases, cancer. The body stops wanting fuel when something is consuming energy from the inside. Don't brush this one off. Sign number 3, hiding and withdrawing. A dog who normally follows you from room to room and suddenly wants to be alone under the bed or in a dark corner is a dog that is struggling. This is one of the most important behavioral shifts to understand because it's deeply instinctive. In the wild, a sick or injured animal hides to protect itself from predators. That survival instinct doesn't disappear in domestic dogs. When they feel vulnerable, they retreat. Unlike cats who sometimes hide just because they feel like it, dogs are far more socially motivated. They want to be near their people. So when a dog chooses isolation over your company, there is almost always a reason: stress, physical illness, emotional trauma, or a condition that's making them feel weak. Don't leave a hiding dog alone for long without checking in. Sign number 4, strange body postures. Watch how your dog holds their body. A healthy dog stands evenly, moves fluidly, and lies down without obvious discomfort. But a dog in pain will begin to use their posture to communicate it, even if they can't use words.
One of the most telling positions is called the prayer position. The dog drops their front legs and chest toward the floor while keeping the back end elevated. This position is a classic indicator of abdominal pain, particularly pancreatitis or stomach discomfort. Another alarming posture is the sawhorse stance, legs spread wide, rigid, and stiff, as if the dog is bracing against something. An arched or hunched back is another red flag, often associated with spinal issues or internal pain. If your dog is holding themselves in a way that looks off to you, trust that instinct. You know your dog's normal. That's worth a vet call. Sign number 5, low energy and disinterest in activities. This one catches people off guard because it can look like laziness. Your dog doesn't want to go for walks anymore. They used to sprint to the door at the sight of the leash, and now they barely lift their head. They used to love fetch, and now they just watch the ball land. Lethargy is one of the body's most universal distress signals. When something is wrong, energy gets diverted toward fighting whatever the problem is, and very little is left over for play, exercise, or enthusiasm.
This is especially concerning in young dogs and puppies, who should naturally be full of energy. In older dogs, it can be easier to miss because we sometimes chalk it up to age. Don't accept low energy as normal without confirming your dog is healthy. Sign number 6, drinking more water and urinating more frequently. If your dog is house-trained and they're suddenly having accidents inside, or asking to go out every hour, or drinking from their bowl like they've been in a desert, this combination is one you absolutely cannot ignore.
Excessive thirst paired with frequent urination is one of the most consistent warning signs of diabetes in dogs. It also points directly toward kidney disease. What's happening in both cases is that the body cannot regulate fluids properly. Even though the dog is drinking enormous amounts of water, the body is still dehydrated at a cellular level. The kidneys either can't filter correctly or the body can't use glucose properly, so it tries to flush everything out through urine. This symptom pattern is measurable and diagnosable. A vet can confirm it with a simple blood or urine test. The sooner you catch it, the better the outcome. Sign number 7, a visibly swollen or distended belly. All dogs' bellies look a little fuller after a big meal. That's normal. What's not normal is a belly that remains visibly swollen, feels hard to the touch, or grows over time without explanation. A distended abdomen can point to several serious conditions. Hormonal imbalances such as Cushing's disease cause the belly to swell over time. Internal fluid buildup, which can come from heart disease, liver failure, or infection, causes the abdomen to expand with fluid. Internal bleeding following injury or trauma does the same. One of the most immediately dangerous conditions associated with a swollen belly is bloat, also known as gastric dilatation volvulus, in which the stomach fills with gas and twists on itself. This is a life-threatening emergency that can kill a dog within hours. A swollen belly is never something to wait on. Get your dog seen. Sign number 8, crying, whimpering, or whining. This one feels obvious, but people still dismiss it more than you'd think.
A dog who cries out when you pet them, when they try to stand, when they move in a certain direction, or simply out of nowhere, is a dog in pain. Dogs are stoic animals. They have been bred for thousands of years to tolerate discomfort without complaint. When a dog is vocal about pain, that pain is real and likely significant. Pay attention to when the whining happens. Is it when you touch a specific area? When they first get up? When they try to jump? That timing tells you a lot about where the problem might be. A dog who keeps distance from you when you try to pet them is also communicating something. They're anticipating that being touched is going to hurt. Sign number 9, abnormal hair loss. Every dog sheds. That's just part of sharing your life with a dog. But there's a clear difference between normal shedding and something that warrants concern. If you're finding large clumps of hair on the floor, or you can see actual patches of bare skin on your dog's coat, that is not normal shedding. It's a sign of something deeper. Skin conditions and fungal infections are common culprits. Hormonal imbalances, particularly involving the thyroid or adrenal glands, frequently cause hair loss in dogs. Allergies to food, to environmental factors, to certain materials can trigger excessive shedding. And chronic stress can also cause a dog's coat to deteriorate over time. Healthy skin and coat are outward reflections of internal health. If the coat is suffering, so is something inside. Sign number 10, neglecting grooming. On the flip side of that, a dog who suddenly stops grooming is also sending a message. Dogs are self-maintaining animals. They lick their paws, clean their coats, and tend to their fur regularly. It's instinctive. When a dog stops doing this, it's usually because they don't have the energy or the physical ability to do it anymore. Fatigue caused by illness can make even basic self-maintenance feel too demanding. Joint pain can make it physically impossible to reach certain areas. Depression and emotional distress can also suppress this behavior. The coat of a sick dog often looks dull, matted, or unkept. If your normally tidy dog starts looking neglected despite your grooming routine, that change in their habits is worth noting. Sign number 11, obsessive licking of one area. Dogs lick, we know that, but obsessive, repetitive licking focused on a single location is always a communication. Dogs lick painful areas. When a joint aches, they lick it. When a paw is infected or injured, they lick it.
When their stomach hurts, some dogs will lick floors, walls, or furniture. This is a documented response to gastrointestinal discomfort. Fleas and skin allergies cause intense itchiness that drives licking behavior. A hot spot, an area of inflamed, irritated skin, almost always develops in spots a dog has been obsessively licking. If you notice your dog returning to the same spot again and again with their tongue, don't assume it's nothing. Follow the lick. It's pointing to a problem. Sign number 12, difficulty standing or moving. Watch your dog when they first wake up. A healthy dog springs to their feet with relative ease. A dog dealing with arthritis, joint disease, or internal illness may take a noticeably long time to pull themselves up. They may hesitate, shift their weight around, or attempt to stand and sink back down before trying again. This is especially visible in cold weather, which tightens joints and makes movement more painful.
It's also most obvious in the mornings after a long period of stillness. Arthritis is extraordinarily common in older dogs. Some estimates suggest more than 80% of dogs over the age of 8 have some degree of joint degeneration. But it's not just an old dog issue. Younger dogs with hip dysplasia or developmental conditions can show the same signs. If getting up looks like a struggle, don't wait to ask your vet about it. Sign number 13, sleeping far more than usual. Adult dogs typically sleep around 14 hours in every 24-hour period, and certain breeds and older dogs sleep even more. But there's a difference between a dog's regular rest pattern and a dog who can't seem to stay awake. If your dog is sleeping significantly more than their personal normal, not just longer naps, but genuine, consistent, difficult to rouse, heavy sleep, that's a red flag. Infections cause the immune system to work overtime, which is exhausting. Thyroid disease in dogs, specifically hypothyroidism, causes profound fatigue. Diabetes, anemia, heart conditions, and a wide range of chronic illnesses all present with increased sleep as a primary symptom. If your dog seems like they simply cannot get enough rest and their energy has dropped off noticeably, their body might be putting all its resources toward fighting something you can't see. Sign number 14, dilated pupils. Most people have never thought to look at their dog's pupils, but this is one of the body's most honest responses to pain. Pupils dilate in low light. That's normal. They also dilate in response to adrenaline, and adrenaline spikes when something hurts.
A dog whose pupils are unusually large in normal lighting or whose pupils remain wide and dilated for extended periods may be experiencing significant pain somewhere in their body. This is an involuntary response. The dog cannot control it. It's your nervous system's built-in alarm signal. Pair this with any of the other signs we've covered today, and you have a strong case for a vet visit. On its own, dilated pupils aren't always diagnostic, but as part of a larger picture, they matter. Sign number 15, pale, discolored, or unusual gums. Make a habit of checking your dog's gums. Healthy dog gums are a warm, bubblegum pink. They should be moist, and if you press them gently with your finger, the color should return within 2 seconds of releasing. This is called capillary refill time. When gums deviate from that healthy pink, it means something is going wrong with circulation, oxygenation, or the blood itself. Pale or white gums typically indicate blood loss, either from internal bleeding or severe anemia. Blue or grayish gums mean the body isn't getting enough oxygen. This is a critical emergency. Red, inflamed gums, especially along the gum line, point toward dental disease or infection. Yellowish gums can signal liver problems or jaundice. Gums that smell unusually bad or show visible ulcers are also warning signs. Check your dog's gums regularly so you know what their normal looks like, because when it changes, you'll notice. Sign number 16, coughing that doesn't go away. An occasional cough in a dog isn't automatically alarming, but a persistent cough, one that keeps coming back day after day, is your dog's respiratory system waving a flag.
Brachycephalic breeds, the flat-faced ones like bulldogs, pugs, and boxers, are structurally prone to breathing difficulties and airway obstruction, so they may cough more frequently as a baseline. In other breeds, a persistent dry, hacking cough often points to kennel cough, which is highly contagious and passes through shared environments like dog parks, boarding facilities, or grooming salons. A wet, productive cough can indicate fluid in the lungs. A cough paired with lethargy, appetite loss, or any of the other signs we've covered today should be treated as urgent. Don't normalize a chronic cough. Have it evaluated. Here's the truth about all 16 of these signs. They're not rare. These are the signals dogs are giving their owners every single day, in homes around the world. The difference between catching a problem early and missing it entirely comes down to how closely you're paying attention. Your dog cannot make a doctor's appointment. They cannot describe their symptoms. They cannot tell you that something has been hurting for 3 weeks. All they can do is show you, and now you know how to look. If this video helped you understand your dog a little better, share it with someone who has a dog, because it might make the difference for an animal who has no other way to ask for help.